Hallux valgus, commonly known as a bunion, is a deformity of the big toe that causes it to deviate outward, often resulting in pain, discomfort, and difficulty wearing shoes. This condition is surprisingly common, affecting nearly 2% of the population in Germany, with women making up about 83% of cases. The causes of hallux valgus are multifactorial, including genetic predisposition, muscular dysfunction, and weaknesses in the capsule ligament structures. Secondary factors such as trauma, osteoarthritis, and neuropathic conditions can also contribute. The diagnosis typically involves a clinical examination and standing weight-bearing radiographs of the foot. While some patients experience significant pain and mobility issues, others may be more concerned with the appearance of the deformity. Understanding the underlying mechanisms and prevalence of hallux valgus is crucial for effective management and treatment planning. In the next scene, we'll explore how this condition is classified and the latest recommendations for its assessment. The severity of hallux valgus is most commonly assessed using radiographic measurements, the intermetatarsal angle IMA and the hallux valgus angle HVA. Traditionally, classifications have been inconsistent, with some systems dividing the deformity into mild, moderate, or severe categories. However, recent recommendations suggest simplifying this to just 2 degrees, moderate and severe. Moderate hallux valgus is defined by an IMA of 18 degrees or less and an HVA of 40 degrees or less, while severe cases exceed these values. This binary approach helps streamline treatment decisions and reflects the correction potential of various surgical techniques. Clinical assessment should also consider factors like joint instability and the presence of arthritis. Accurate classification is essential not only for choosing the right treatment, but also for setting realistic expectations for patients. With a clearer understanding of severity, let's move on to the available treatment options and their outcomes. The primary approach to treating hallux valgus is conservative management, which includes patient counseling, pain medication, footwear adjustments, physical therapy, and orthopedic aids like insoles or splints. If symptoms persist after about 3 months, surgical intervention may be considered. There are over 130 described surgical techniques, but the most common are joint-preserving osteotomies and joint-stiffening arthrodesis. Recent evidence shows that all major surgical techniques provide comparable correction of the deformity and similar improvements in patient-reported outcomes, as measured by the AOFAS score, which typically improves by about 34 points after surgery. Complications occur in roughly 18.5% of cases, with metatarsalgia, recurrent deformity, and joint stiffness being the most common. Importantly, patients with more severe deformities and greater functional impairment tend to benefit most from surgery. The trend in Germany is moving toward fewer operations and more outpatient procedures, reflecting advances in surgical techniques and perioperative care. In our final scene, we'll discuss the patient journey and what to expect during recovery. After hallux valgus surgery, the primary healing period typically lasts 8 to 12 weeks, though recovery can vary widely. During the first 2 weeks, patients should keep the foot elevated and limit weight bearing, often using crutches and a special surgical shoe. Swelling and reduced joint mobility may persist for several months, and returning to work depends on the patient's occupation and commute. It's important for patients to understand that setbacks like pain, swelling, or scar issues are common and part of the healing process. A close doctor-patient relationship and thorough preoperative education are key to managing expectations and achieving the best outcomes. Ultimately, while the journey can be challenging, most patients experience significant improvements in pain and function, especially those with more severe deformities. With advances in both conservative and surgical care, hallux valgus can be effectively managed, helping patients regain comfort and mobility in their daily lives.